Greetings, everyone, and welcome to a discussion on the potential of AI technologies for healthcare. Before we dive in, allow me to introduce myself, although that phrase may take on a surreal meaning today. I'm not the real speaker, nor did the real speaker write this introduction. The voice you're hearing, the image you're seeing on the screen, and even these introductory words were all generated by AI systems. We are actively amidst the arrival of a set of disruptive technologies that are changing the way all of us do our work and live our lives. These profound capabilities and potential applications could reshape healthcare, offering both new opportunities and ethical challenges. To make sure we're still anchored in reality, however, let's welcome the real-life version of our speaker. Take it away, Dr. Jonathan Chen, before they start thinking, I'm the one who went to medical school.
Wow. Thank you for that kind introduction. I don't know. Dean Miner, do we actually have to be here tonight? I'm pretty sure AI could just give our presentation for us at this point. I certainly hope and wish emerging AI systems will answer the overwhelming flood of emails and in-basket messages I have to respond to, and open up new paradigms of care so we can actually reach all of the patients who need us. In the US alone, tens of millions, let alone the billions of people worldwide, have deficient access to the most important scarce healthcare resource, which is access to a medical expert, someone who knows what they're doing. Make this concrete, I'm just going to tell one very simple story. I saw a young woman in my clinic years ago, and she said she had worsening fatigue. She had her heart was racing. I did some initial tests and found, oh, you have a thyroid hormone imbalance. No problem, miss. I'm going to refer you to our endocrinologist, our hormone specialist. They're going to take good care of you, get you diagnosed and treated properly. She calls a specialty clinic. Next available appointment will be 3 months from now. That's crazy. My patient can't just wait 3 months for care at this point. So in real life, what did I actually do? What I actually did is I pulled up my textbook. I went to an online reference. I hacked together the treatment and management plan, while I also called my old classmate who was an endocrinologist to double check I wasn't doing anything stupid. Through sweat and tears and many uncompensated late hours at night, we did what was necessary just to make it work, because that's what was needed. Does it actually have to be like this? Technically, as a licensed physician, I could order every medication, every test, every procedure a patient could need, but what I can't do is keep track of the tens of thousands of options that advances in medical sciences make available to us. We are clearly well past the point where the complexity of modern medicine exceeds the capacity of the unaided expert mind. In building towards a future vision, what if we had multiple tiers, layers of consultation support? Sometimes you do need to see a classic in-person doctor's visit. If you need a surgeon, look, I don't care how much AI or decision support you give me. I am not doing your colonoscopy for you, okay? But we found electronic consultations can do a lot. Essentially, a primary care doctor could email a specialist, get an answer back in days rather than months to start getting your care underway. Couldn't we start to build towards even more fully automated digital consultation guides? Can we look at all of our medical record data, discover and distribute the latent knowledge embedded in that data so that we can empower individuals with the collective experience of the many? You know, why is it when you're on Amazon or YouTube, it seems to know what you want before you even completed your thought? It's actually just looking at all the prior data. The next time I ask for a consult, refer a patient, should the computer be able to anticipate, well, this is probably what that specialist is going to do, given the thousands of times we've seen it? It's all very possible nowadays. Even with what you can do with a recommender system, here's a broader thought. I want you to think about not just where we are, but where we are going. This is a chart showing over time, over several years, how well different language model systems have done on accuracy of answering medical exam type questions. We all became aware, right? Disruptive technology emerged less than 2 years ago. The first version of ChatGPT, holy smokes, GPT 3.5, 60%, out of the box. It could kind of barely pass a medical exam. I had some of my colleagues lament, well, if you want a doctor who barely passed medical school, you feel free and talk to this chatbot. This thing's not smarter than me. And I thought, boy, is that the wrong way to think about this? A few years ago, this technology was unusable. Now it's barely passing. It is not that hard to project where we are going in the not distant future. A matter of months later, GPT-4 and MedPalm-2 emerge, and they can handily pass these exams better than your average doctor would. And this chart is already out of date. MedGemini, now GPT-01, just came out like a week ago, are literally off the charts on some of these scales. Then again, what is this? Multiple choice questions? Nobody's job is to answer multiple choice questions all day. We have to deal with much more complex, open-ended reasoning in the confines of medicine. We raced to get this study done last year. We took the actual exam we gave Stanford medical students. Very complex clinical vignette, and it's not multiple choice. It's describe this case in 200 words, give a differential diagnosis, explain your reasoning, and we have a very rich and nuanced way to score such answers. And surprisingly found GPT 3.5 out of the box. That's the score distribution, and it's basically showing it was just barely able to pass exam just by itself. That was surprising enough, and we could barely turn our head and like, hey, holy smokes, GPT-4, we had to redo the entire study because now it is not even close. It can handily pass the exam, not even close. Just for reference, in the red here, that would be Stanford medical students. Everybody passes, it's okay, it's okay. But consider this. This is a test we give our real students to screen them to see if they have enough knowledge to be ready to see real patients. What is the point of this test now? What does it even mean when a fully automated, publicly available chatbot can handily pass this exam and outscores our average medical student by a couple points? Then again, as amazing, you'll keep seeing more and more of these studies. AI does this, AI does that. Wow, seems so cool, very impressive, but also irrelevant. Because nobody's going to let a robot take care of a patient. Yet. The more relevant question is what happens when you give a human access to these tools? Does it actually make a difference in what they do? We completed a randomized control trial. Complex clinical cases, yes. Tough diagnostic cases. Nuanced grading. It's not simple multiple choice. Much more nuanced reasoning evaluation. And then we randomized half of live doctors in these cases. This is our score distribution. And feel free to look up anything on the internet, right? Because that's a realistic scenario. Just don't use any of these new large language model chatbot AI systems. And they can perform pretty well. It's a very tough benchmark to beat. We randomized the other half of doctors. We gave them GPT-4, and surprisingly, didn't make that much difference. Which is really weird, because if you just ask GPT-4 by itself, it actually outscores all of the doctors, including the doctors who had access to GPT-4. Like, what's going on? This is not what we expected, because this really flies in the face of the fundamental theorem of informatics. Human plus computer, when combined, will deliver better results than either alone. I don't know, this human in the loop in the middle sure seems to be just slowing the computer down, like just let the robot take over already. Is that what this means? It's not what this means. That's not what this means. What this means is we clearly need to really retrain an entire workforce to understand how to effectively use these tools so we can best get the potential out of them. Even with such results, I've had many colleagues counter and say, well, okay, fine. Computer's very smart, knows a lot of stuff. Hey, I have the human touch. You can't simulate the kind of empathy and personal connection that only I can provide my patients. So there's actually been some fun studies in the past couple of years showing the surprising level of empathy of doctors versus robot-generated text, but we'll isolate a very specific story. This is a very brief 2-page essay. You're going to find this in a Stanford Medicine magazine you'll have available tonight, where early on I got a hold of one of these chatbots and I challenged it with some very tough scenarios, ethical dilemmas. There's no way it can handle this situation, inspired by real cases. I saw a patient with worsening dementia, choking on his own food, has pneumonia. The other doctor scheduled him for a permanent feeding tube into his stomach. I had to talk to the wife to talk through what was going on and what to expect. After that tough conversation, I went to the chatbot. I said, chatbot, you pretend to be the doctor counseling me, and I'm going to pretend to be the patient's wife. I want to see how you would have handled that conversation. And I hit it with all of the most challenging, most fraught, emotional, dramatic statements that any reasonable family member would bring up, that indeed were brought up. Look, doctor, I don't know. I mean, I don't think this is how my husband would have wanted to live, but if we don't do this, he's just going to starve to death. I mean, what choice is there? He never gave up on me. How could I give up on him? Everyone would blame me if I don't do everything I could to save his life. Read the essay for the full dialogue, and the summary point of it is, as I was trying to do this exchange, after a few turns, I realized, holy smokes, this chatbot is starting to provide better counseling than I did in real life. After I got past that existential angst. It took me an evening or two. It did get me to think optimistically, though. There's actually something very compelling here. This very weird human-computer interaction I was having, what it was actually letting me do was to practice a high-stakes conversation in a low-stakes environment. And strangely, the computer was helping let me practice and train and be better at the most human skills we do need in medicine, communicating with our patients and their families. Warner Slack famously once riffed off Arthur C. Clarke. He said, any doctor that could be replaced by a computer should be replaced by a computer. Many people misinterpret this and think we're advocating for replacing humans. That's the exact opposite of what this quote means. Any good human you cannot replace with a computer. We provide a very different and distinct value that cannot be replaced. Having said that, my colleague Kurt Langlois might say, well, AI is not going to replace anybody. Those who learn how to use it may very well replace those who do not. With that in mind, I'm very glad to be at a place like Stanford where we can be advancing this cutting-edge technology, creating the underlying systems, but also where we can redefine how we train and retrain entire generations of the healthcare workforce so that we can safely and effectively integrate intelligent systems to actually reach all of the patients for healthcare that we need. Thank you, everyone. Have a wonderful evening.